And to health matters, Taraba State government says women in the state are the most vulnerable to HIV infection with a high rate of 68%. Speaking at this year's World HIV Day celebration in Jalingo, the Director General of Taraba AIDS Control Agency says the prevalence rate of HIV in the state has been reduced from 10.5% to 2.9%. Olabi Adenusi-Fiden, this report.
The United Nations Program on HIV/AIDS says currently 38 million people globally are living with HIV and millions have died of the infection. The estimate from the 2023 spectrum placed the number of people living with HIV in Nigeria at 1,910,405. Using the UNAIDS 95-95 fast-track strategy, the global community seeks to end the AIDS epidemic by 2030, thus attaining the 3.3 Sustainable Development Goal. The modeled HIV prevalence in Nigeria varies by state, with Benue 5.7%, 95% CI, 5.0 to 6.3, having the highest prevalence, followed by Rivers 5.2%, 95% CI, 4.6 to 5.8%, Akwa Ibom 3.5%, 95% CI, 2.9 to 4.1%, Edo 3.4%, 95% CI, 2.9 to 4.0, and Taraba 3.0%, 95% CI, 2.6 to 3.7%, placing 4th and 5th. This has been of great concern to the Taraba State government, as it's now working hard to change the narrative using this kind of awareness campaign trek led by the First Lady in the state in commemoration of World AIDS HIV Day. The trek ended at the trade fair field in Jalingo, where students, youth groups and women and other critical stakeholders gathered to create awareness.
There are 45,007 clients currently receiving treatment in the state, out of which 30,821 clients.
Addressing journalists at the end of the rally, Chairman of Taraba AIDS Control Agency Dr. Garba Danjuma reeled out a scorecard of the state government in the fight against HIV/AIDS. He says women have the highest figure of HIV infection in the state, and he increased his call for people to go for testing.
So far so good for Taraba State, a state that was able to reduce HIV prevalence from 10.5% to 2.9%, I think has been very supportive.
He said that the state has not recorded cases of HIV-related deaths due to the potential of the new HIV drug administered to patients.
All HIV-positive clients to adhere their treatment judiciously, because studies have shown that if they achieve what is called viral loss suppression, they can not transmit to another person.
Dr. Kefa's administration says it is poised to invest more on the health sector, particularly to eradicate HIV in the states.